April 11th is our third session. It's always called the same thing, which is coping with coronavirus. And I wanted to put this a message of diligence. That means we're all doing what we need to do. We're diligent. And reassurance. The other thing is so important because people are afraid all over. And the main thing that you and we together are trying to do is help people not be afraid in this time of chaos and panic. We are helping everyone we know not to be afraid by what you're learning, well, by what you already know, but also what I'm teaching you on this series of live emails. So I'm teaching you to think like a scientist, think like an epidemiologist, so that when you decide to do things, you know what you need to consider before you do them. We'll talk a lot more about that. So one thing you need to do is to think like a scientist. You need to check your source. Check your source. Find out who is giving you this information. If it's just one of the news medias, that's not necessarily a good choice. You have to see who they're quoting on their article. So I'm telling you that I am a Stanford MD graduate. That means I elicit a certain amount of credibility just by saying that. I'm also a former epidemiologist, hospital epidemiologist. And I was one of the very first infection control nurses in this country. And I went all over the country teaching people, health departments, the Army. I consulted for the Army. I consulted for the Air Force. I consulted for the Centers for Disease Control when I was in love with hepatitis B virus, and I knew a lot about it. So I've had a lot of experience in doing this. And the only thing that I speak is the truth, and I only quote other people, other verified people. And if I don't know for sure, then I say, this is what so-and-so said, but it hasn't been proven yet. Hasn't been proven without a doubt. Okay. So you only go to excellent sources like the New England Journal of Medicine. but that has to be excellent. Okay. We're going to use the same format every time that we're on this. And it's going to be, I'm going to talk very differently this time because it can't be an hour and a half. Although I appreciate all the thousands, over 5,000 just in one video, who watched this from beginning to end for an hour and a half. I don't even know how long it really was because I had 10 pages of notes and I was determined, however long it took, you're going to hear everything on those 10 pages. So I can't tell you how much I appreciate the labor of love that it took to listen to those videos all the way through. So we don't know how many are in the Army because we haven't had everybody registered. We don't know on Zoom at all. We only know a little bit on Facebook, but if they didn't like my page, or if they didn't do this or that, we have no idea. And we have no idea how many people have shared this with all the, I want you to do this too. Share it with at least one person you know who's afraid. If you can find 3 people who are afraid that you can share this video, ask them to watch it. So, so I don't know how many, but I know it's in the many thousands, okay? I know it's got to be at least 10,000. These people are who are in the Army standing shoulder to shoulder with you, virtual shoulder to shoulder. And they are in about every single state in this country. They are in very many countries, African countries, India, the UK, Ireland, Switzerland, all over, Australia. I'm so excited because I get to talk to all these people, talk all over the world. So the requirements to join the Army, as you all know because you're in the Army, but I'm just going to say it quickly. You need to be a seeker of the truth. You need to be non-judgmental. That means anybody can be or do anything they want as long as they don't hurt other people. Because the third thing is you have to be kind and compassionate or want to be more kind and compassionate. So if you have those 3 qualifications, you can be in this Army. Everybody's equal in the Army. everybody. So in this army, I'm just going to mention a few people so you know who's standing with you. George Fisher, who is in my class at Stanford, and he did both an MD and a PhD in cancer biology, the biology of cancer, and an MD, and then he did a fellowship in oncology. So he is now a full professor at Stanford, and he has somebody's name next to his. When people have are a full professor, that means they've been there for a really long time, and when they have a name next to theirs, that means those people who he probably helped or their families, they're paying for him to be, they're his paycheck. Then we have George Scullard, who's my also friend from Stanford. We worked in the laboratory together, and he taught me, we were both working with the hepatitis B virus. I used to be in love with hepatitis B virus. And so he was in the lab when I was, and he was from a special place in London. And so I knew he had to be really good. And he also, I'll just mention this briefly, but he also went back to Spain. He was at Stanford when there was a long delay in getting his license okayed. He went back to Spain, and even though he's a gastroenterologist, that means stomach and gut and colon, he studied HIV, and he took on what must have been almost every HIV patient in London. They all wanted to come to him because he's the kind of doctor, kind and compassionate, does everything himself, including drawing the blood and taking the blood pressure. Anyway, George Scullard. So he lives in Spain now. And I told you, I think we need a lot of psychiatric help and psychological help on this journey. So we know we have my friend, and all these people are doctors in front of their names, but to me, they're just who they are. Paul Roberts, he's in Seattle. Dennis St. Peter, believe it or not, that great name, St. Peter, he's in Santa Cruz. Mary Beth Fox, she's an adolescent. She did two residencies, one in pediatrics and one in psychiatry, and she's an adolescent psychiatrist. So you're saying to yourself, well, what is this? This means these people are standing there with you. You might not be able to go to their office, but in your mind's eye, which is one of your main armors, you have everyone has this. Everyone in their mind's eye can see these people. You can look up these people on the internet because they'll all be there. And the fourth one is my friend from high school. His name is, believe it or not, Thane, T-H-A-N-E, Sibley, last name Pittman. He's now in Palm Springs, from Youngstown, Ohio. Now he lives in Palm Springs, and he has studied human behavior. So all these psychiatrists are with us. Then we have Dr. Bonnie Raskin. She's internal medicine. She's in Pleasanton. You'll hear more from her later. Dr. Patricia Rogers, who's my classmate from medical school, who's an OBGYN, wonderful OBGYN. And she is in Austin now, Austin, Texas. And we have a kidney doctor, Brian Donner. He is a kidney doctor, and he's going to be on today. And I saw him last week in a visual. I went to a doctor on a visual whatever. And he is saving my kidneys. I have stage 3 chronic kidney disease. That's because I had cancer and I was given cisplatin. And I bet you any money, there are so many of you that there are quite a few people who have had cancer of some sort. And you're survivors so far. I'm only a survivor 2 years, so I don't know how long it's going to be. And if you've ever had cancer, that is the greatest fear of them all, that cancer will take your life and take you away from your family. So cancer survivors, and I bet there are a lot of people who had this drug, cisplatin, when they had the cancer. It's either take cisplatin and risk having your kidneys destroyed, or you want to die instead. So you say, sign me up for cisplatin. The next group is health coaches. Health coaches like me, I learned at Health Coach International, and the CEO of Health Coach International, Eric Nooner, he's on this call, he's in this army. And the health coaches from everywhere have been joining us. They do every kind of health coaching you can imagine, for weight loss, of course, for autistic children, for people who need kidney transplants. I've gotten their messages from everywhere to say what kind of health coaches they are. And they're all here in our army with you. And they're all standing side to side. Then we have my my little niece is, she's not little, but her daughter is, Serenity. She's 6 years old, and I wanted to be able to show you the picture of the victory garden that Serenity planted last week. And I wanted to be able to show you the list of all the vegetables in the garden. And I wanted to be able to say how many pots of soil her mommy, Erica, dragged herself when she has a disability. I won't say what because I haven't checked with her yet. But this is not an easy thing for anybody to do. And she dragged all these bags of soil to help plant this garden, Victory Garden. And so I'll show you the picture next week because guess what? My printer really ran out of toner. It's been saying it's going to run out of toner for a year. Today is the day when Jillian was printing everything out that ran out of toner. So I can't show you Serenity in the Victory Garden. Next week. Last week I asked you to email me what children you wanted to help make a better world for, and what your gifts were that you're sharing with other people to be able to help during this epidemic. One person emailed me at my outlook.com email, which I sometimes mix up and say it's Gmail or it's Facebook. There's no Facebook for this. Anyway, it's my friend Bonnie Rathjen. She lives in Pleasanton, California. It's in the San Francisco Bay Area. And she was my resident. And that means she was ahead of me. She's not older than me, but she was ahead of me when I was an intern. And so she writes this back. The children that she wants to make a better world for are, and I'm saying these things to make you see that these are real people and real things. I'm trying to get you familiar with people that are with you. So Jonah, Andes, Everly, Stephen, and Olivia. Her gifts: to truly care about other people, animals, plants, and our earth, to participate in causes and to donate time and money, to listen to my patients. That's not an easy thing to do. When the insurance companies make you see everybody in 10 to 15 minutes, it's hard to listen to somebody in that short amount of time. Really listen. To explain well and to make complex medical diagnoses on her patients. Those are her gifts, and those are the children, and that's what she does. And she's also sewing masks in her spare time. She's a really good person in sewing. It's a low battery. She's a really good person in sewing, and so she's going to make my husband and my daughter and I masks with our cheek measurements and our face measurements. So I'll probably be wearing one next week, even though I don't need to wear it for this. We'll talk about that too. The next thing we're going to do is update on the pandemic. And this is where I need that. Because I can't print things, I've been saving them on various devices. So this one I was saved on my old iPad, very old. So I'm going to update you by showing you, well, I won't show it to you, but I'll show you how it looks. Oh no, that's no good. Yes, now you can see kind of how it looks. Okay, so this is a COVID-19 daily dashboard. It gives you a global case count. Now this happened to be April 7th, so it's way more now. By April 11th, this is probably outdated, but it will give you an idea of what we're talking about. So it will give you the number of infections, the number of deaths, the number of people who recovered, or what percent. Will also give you the number of deaths per million. This will give you an idea of the United States versus various other countries. So in the United States, as of April 4th, no, this is as of April 7th, we've had 1,362,045 infections. That means positive, proven infections. That doesn't include all the people that have mild symptoms or people who have been very infected but have never gotten a test. It doesn't include all the asymptomatic people who are walking around carrying this virus. And so it doesn't include any of them. But not including them, we have almost 1.5 million infections. Of those, we have 76,328 deaths. So of the million, our death rate is 5.6%. And then we have 300,000 who have recovered, 21%. So these are the highest countries. I'm not going to read you 25, but I'm going to read you certain ones that that are also compared to us. So we have I'm going to round it off. We have 370,000 deaths. Spain has 370,000 infections. Spain has 140,000 infections. Italy 132.5. Germany 103. France 98. China 81. Iran 62. The United Kingdom 51. Think of how small the United Kingdom is, but it has 51,000. And I'll just read you the next three are Turkey, Switzerland, Belgium, Netherlands, Canada, Austria, Portugal, Brazil, South Korea, Israel, Sweden, Russia, Australia, Norway, Ireland, Denmark, India. India, which is at the bottom of the 25, it has 5,000 infections. Of the deaths, the United States has 11,000. Spain has 14,000. Now, mind you, Spain has a quarter of the number of people infected, but it has more deaths than we do. This gives you the idea. Italy has 132,000 people infected, but they have 16,500 deaths. We have 11,000. Italy has 16,500. Spain has 13,800. Recovered, the US, 19,000, almost 20,000 have recovered. Spain, 43,000. Italy, 22,000. So Italy has 16,500 deaths and only 22,000 have recovered. This gives you also the number of infected per million. So that takes away the different sizes of the states, okay? So in the US, we have 1,111 infections per million people. Spain has 3,000. We have 1,000 infected in a million people. Spain has 3,000. Italy has 2,000. France has 1,500. So the other ones that are top ones are Switzerland, Belgium, the Netherlands, Austria, Portugal, Israel, Norway, Ireland. Those are the top ones. The next one is the number of deaths per million. These are the people who have died from COVID all over the world. I'm giving you an update on the world. I hope you're listening, Jeanette, because I can see your face, even though you don't know I'm looking. Oh,
11.
Yes. Jillian is saying as of today, there are 20,000 deaths in the US. Okay, 20,000. So that means between the 7th and the 11th, it's gone from 11,000 to 20,000. Some of that is we have more tests available, but a lot of it is we have a heck of a lot more cases. So I'm going to have to give you the latest. I couldn't find the latest for today, but yet next week I'll give you the very latest. But this is as of the 7th of April. The deaths per million in the United States are 33 deaths out of a million people. Spain has 300 deaths. We have 30. Spain has 300, 10 times the amount of deaths per million. Italy has almost the same number, 273,000. So that will give you an idea of what's happening with this pandemic and what's happening in the world. And just the fact that in our country, there were on April 7th, there were regardless of what the confounding factors are. Confounding factors are things that might change the number, what the confounding factors were. But it's gone from 11,000 to 20,000. That will give you a pretty good idea. I'm pausing, but I'm not worried because this is not a professional presentation. This is a person, if I'm doing a professional presentation, I plan it way far ahead. I do a slide presentation and I make sure everything is exactly correct. This is just a person who's trying to help you, who's qualified to be able to help as many people as I can. That's who this is. So so I don't mind if you see me looking at it. I have notepads, but luckily I don't have 10 long pages this week that I'm going to make sure you hear everything. This time I just have, see, I have 5 note cards. That should be encouraging. All right. Now we're going to update the virus. First, we're going to talk about the epidemiology. If anyone wants to take notes, this would be a good time to do this. If you want to tell other people, if you want to sound like you're an epidemiologist. Okay. You remember I told you this before, and I have the updates on my Facebook page. Session 1, that's where I wear a white blouse. Session 2, where I wear a blue blouse. And session 3, see, purple blouse. Session 3, purple. White, blue, purple. All of them are on my Facebook page, and Jillian figured out how for me to send them to you. So anybody who's on the Zoom, just write me on Outlook. Putting this up. I didn't put it up high enough before. Write me on Outlook.com and I will send you session 1 or session 2 if you don't have it. Marilyn Roderick, MD at Outlook.com. Jillian's helping me. Yes, Jillian Nicely, my wonderful daughter. She's my ace in the hole as far as technology goes. I've told all of you, and most of you know this, technology.
6 feet away.
She's 6 feet away. She is 6 feet away, and she is helping me because my #1 enemy is technology. You have no idea. Just my computer deciding today's the day after you're telling it's low on toner, it's not going to print. So just believe me when I tell you, when I try to do anything, it's going to be different from someone who knows how to do it. So I've told you that the source of this virus was in bats. That's the source of Ebola. That's why SARS. That's why do bats? I don't know. The answer is I don't know. And it probably it could go to a number of different animals. It's a zoonose, Z-O-O-N-O-S-E, zoonose infection. It goes from animals. Well, that part, it goes to other animals. It goes to chimpanzees, and it goes to things like camels too. But it's usually some type of monkey. And then from there, it goes to humans. So bats, monkeys, humans. I said last week that, and now I'm quoting Dr. Fauci, there's no way that this virus could have stayed in China no matter what they did or how soon they did it. It's going to be all over the world, like it is now. So where is this virus going? We call it reservoir in epidemiology. The main reservoir is human lungs. Human lungs and associated what we call secretions. That would be phlegm, coughing, phlegm. It would be nasal discharge. So those are the things that you need to realize and be careful of that are the most infectious things that you can come into. The other thing is that I want to mention is intubation. You keep hearing about these doctors in ICUs, intensive care units, and I've told you before that only a small number, maybe 5% of people who get infected, 20% go to the hospital, 5% go to intensive care, 2 or 3%, maybe 1% are put on ventilators. In order to get on a ventilator, a doctor has to put a tube down your throat, not into your stomach, that's not good. You put it into your trachea, and it goes into your lungs, and this machine helps you breathe. But during intubation or extubation, when you take the tube back out again, there's a huge amount of virus, and they figured all these different ways of face shields and various things to protect doctors when they have to intubate people. My cousin Jenny had this question, and I think it's important because I'm going to be answering questions as we go along that people have asked me during the week. She has heard.
And say that they can ask you too.
You can ask me too. You can ask me too.
Write them in the chat.
And you can ask me on this chat thing, or on Facebook you can ask me, but on the Zoom you can ask me in this chat.
Yeah, nothing's on that.
Okay. All right. Sorry. I appreciate you holding the line while I'm looking. Okay, so Jenny has heard that once somebody is intubated and on a ventilator, that's the name of the machine that breathes for you. You get intubated, the tube goes in your mouth down into your chest, and the ventilator is what breathes for you. Jenny said she's heard that that once somebody is on a ventilator, they're never the same. That question, the answer is no. No. Most everybody that's on a ventilator gets off it and is normal afterwards. The ventilator itself or the breathing with this machine, unless it's happening when you're having CPR, you know, and your lungs aren't working from that and your heart's not working either, then it's all bets are off as far as if you get on the ventilator, if you'll ever be the same. But for most people, they are fine when they get off the ventilator. It may take them a while. They wean people off the ventilator. They don't just pull the tube out right away. You wean the person by allowing them to breathe more and the machine to breathe less. That's what happens. You wean people off a ventilator. So so the answer is most people are fine, but not everyone. The next thing I need to talk about is fomites, F-O-M-I-T-E-S. F as in Frank, O-M-I-T-E-S. That is inanimate objects. Now I'm teaching you epidemiology. Inanimate, that means not living, not alive. Inanimate objects. So I'm going to tell you a brief story. I have to keep my stories brief, I know, because we can't go an hour and a half on this. But I have to tell you this. This reminds me of the old days in infection control. My old days, believe it or not, are 1970 to 78 when I went to medical school. Those are the old days. I can't even believe it. At any rate, in the old days in infection control, at the beginning, when we were trying to figure out how to prevent infections in hospitals, all of us came together. I won't go into detail about that, but there were nurses who are taking care of patients. There were laboratory people, very smart laboratory people, who were in the lab. And the nurses were talking about preventing infection from patient to patient, or patients to each other, or patients to us, whatever. The laboratory people were swabbing everything you can think of. Swabbing meaning taking not a little alcohol swab, taking a long stick with a cotton swab, cotton thing on the end of it, and they would go around the tables. That's what's happening right now. They would go on they would go on the various types of surfaces, right? That's what's happening now in an effort to learn about this virus. You can see, I'll tell you where you're going to see everything about this, but also on the previous videos, you can see what happened about various times the virus lives on various surfaces. But I will just summarize it to say the maximum amount of time this virus can live outside of the lung. It's not alive. It is not alive. It's only alive. It's like a parasite. It's only alive if it's in a person. The virus is only alive if it's in a person. So the maximum amount of time it can survive on an inanimate object is 3 days. 3 days. So when you're thinking about how to protect yourself and your loved ones from this virus, and you go to the grocery store, well, wait, I can't tell you that yet. I'll have you learn how to wear the mask first, okay? So let's see. Well, for prevention, we know about social distancing. Everybody knows now. It used to be 3 feet, but now they've done studies and say, well, to be super careful, it has to be 6 feet. Super careful means out of an abundance of caution. We use that in medicine about all kinds of different things. An abundance of caution. So out of an abundance of caution, you're staying 6 feet away from everyone. Out of an abundance of caution, you're staying inside your house. It's important to stay inside your house. The reason that you and your wife can't go have cocktails at your neighbor's house, but there are only 2 of you and only 2 of them, no, it's because you don't know who's infected. You have to assume, like we did in the old days. Finally, we got to the point where we realized we had to assume everybody had it. Assume everybody had the infection.
Because it can incubate for 2 weeks, right?
Jillian is saying the incubation for this virus can be as long as, well, 2 weeks, probably less than that on average, maybe 10 days, but it can be a maximum of a month. So that's how long the virus is found in your sputum, a month afterwards, even after you've recovered. So the incubation period can be long. And also a lot of people, we don't know how many because we haven't had enough tests. A lot of people are positive, they don't even know it. So that brings us to the masks. The masks, now I'm quoting Dr. Fauci, now I'm quoting the CDC. I'm just going to be quoting them without actually reading it to you. I am saying what they're saying. There are 2 reasons to wear masks. One reason is if you're a worker in the intensive care unit and you're taking care of patients who have known disease or suspected COVID disease. The other one is really the people at home taking care of people at home. They're caregivers, people living in the same space. They can't stay 6 feet away.
Coming to your space, like
What?
or people that are coming to other people to help them.
Or people that are coming to the other people to help them. Jillian has a mask on. Can you see now? She's 6 feet away, but she has a mask. There she is. Say hi to all your relatives. Hi, Jeanette.
Hi.
Okay. So I was going to read from my iPhone, but now I'm not. So those 2 reasons to have a mask. Now the other reason that most people are advised to wear a mask now is this. Since we don't know who has this disease, we're assuming everyone has it. We're assuming everyone is capable of spreading it to someone else. The reason you put that mask on is when you go someplace like the grocery store or the post office. You shouldn't be going there anyway, but my mother, 95-year-old, she goes to the post office. Everyone there but her has a mask on. Anyway, or the drugstore. Those are to get medical care, the drugstore and the grocery store, those should be the main reasons that you get close to people, And you might not be able to stay 6 feet away. So then you should have a mask on to protect others from you, not to protect you from them. They don't want, why it took so long, and I'm not at the CDC now. I don't have any inside stories. I used to have inside stories, but now I don't. But I can tell you that the reason it took so long for this mask wearing information to come out in President Trump's task force or in the CDC recommendations or from NIH, Dr. Fauci. It took so long, and Dr. Fauci said we've had meetings for several hours, many hours every day, I can tell you that. Because they didn't want our country to look like, I hate to say it, but we know China looks like this, but they're having an abundance of caution. We're non-judgmental, remember. If you're in this army, you're not judging other people. Out of an abundance of caution, they all wear masks whenever this is happening. In our country, we know how to think about this, and we are wearing masks when we're in contact with other people that are closer than 6 feet away to protect those other people from us who might be infected. Okay, now, what I want you to do with me, these are for people that are technologically challenged. Okay, so you get out your phone, any phone, or your computer, and you go to, on whatever function you have to press, like Siri or Safari or something like that. You go to that, and at the top, you type in, CDC, whoa, it's hard for me to do this backwards, as you saw last week. You type in cdc.gov, okay? Everybody do that. Everybody do that, because this is where you're going to find all your answers to all your questions, so I don't want to answer them today, okay? And underneath that, it says, now I have to find out how to open my phone, my Face ID, I have to put in numbers, I can't open my phone because somebody might steal my identity. Okay, the next thing you see is symptoms of coronavirus. I'm trying to put it so you can read it.
They're probably not really going to be able to.
Okay, symptoms of coronavirus, corona, there it is. Okay, coronavirus disease 2019. It's got this lady on it. So you click the arrow that's in the middle of the red button. Okay, and below that arrow, it's going to have everything you want to know up to date about the masks. That they are, what types of masks they are. The most powerful ones are for the workers and the people exposed, and they're recommending that you wear, what are you trying to do?
Ignore me.
Oh, ignore her. They're recommending that you wear cloth masks. The best thing I saw this week, there are directions on CDC for how to make any kind of cloth mask. I guarantee you, if you watch this, you'll be able to make yourself a mask from home. He makes them out of a t-shirt. I'm talking about the Surgeon General now. You can see him on my website. The Surgeon General taught us how to make masks this week. And you can make them, this is, I think, from a t-shirt. Anyway, he folded it and folded it and folded it, and then he got 2 rubber bands out and put it on either side, and then he held it up to his face and said, now you have a mask. So all of you probably have something, you have rubber bands, I hope. You can make a mask at home. And every other question you have is going to be answered on that CDC site. And the next thing we're going to go over is treatment. I'm going to say this slowly. My cousin, Beth Lindquist, doctor, she's a retired professor. She says the CDC website has helped her. So, thank you, Beth. So let me say this. There is no proven treatment other than supportive care. Supportive care is something that means extra oxygen. It means someone else feeding you or making you dinner. It means care for your fever, taking antipyretics like Tylenol to bring it down. Don't always take aspirin because that can create holes in your stomach. But Tylenol, acetaminophen, the generic Tylenol. So that's supportive care. Hot packs, cold packs. Keep your head up, keep your head down, help you sleep, help your fever go down. That is supportive care. That's the only thing we know that will help. Now this week, you remember a couple weeks ago, I said, next week we'll talk about hydrochloroquine. Should everyone in the country be taking it? And the answer was no. And the answer last week, a lot of people thought was yes. And the answer this week is no. Why is it no? So to get the complete answer, and Chris, and I'm sorry, Chris, I've looked everywhere for your exact name. I couldn't find it fast on Facebook. That's me, Facebook. I can't find things easily. Anyway, he asked me this question on Monday, and I typed out a complete answer. It took me probably 20 minutes at least to type out the complete answer. I went to send it to him, and it disappeared. But then I realized his question is really important, so we're going to answer it this time. I answered it last week, but I'm going to answer it again, more briefly than I did last week. Okay, so I used to be a certified principal investigator at what's called a phase 1 research unit. That means the very first time you give a medication to a patient, to a human being. So I was an investigator on this unit, and I knew if it was going to be studied by us, it had to have been shown to be effective, and it had to be shown to be not killing, safe, relatively safe in animals. I know people don't like animals being tested, but it's either not have any, either humans or animals. So would you want to take a drug that had only been tested in the laboratory? All right. So when we're doing that, we get we screen a lot of patients. We make sure they're about the same age, because we are going to have a treatment group and a control group. Why do we have that? Because when you give a treatment, if you have no control group, and they're both, we give a fake drug to the control group, so it looks the same. So nobody knows. We don't know. The researchers themselves, we don't know what's the treatment group and the control group. That's important that no one knows. So we screen a whole lot of people to be able to get people that are the same age, that don't really have any other problems, because they need to be healthy volunteers at first, healthy. So we have a treatment group and a control group. It's usually a small number, like maybe at the most 20, 15 or 20. The N is the number in the group. N equals number in the group, number in the study. Okay, so first we give it to them, then we look for everything that could possibly go wrong. So these people have a ton of blood tests first to make sure they already don't have a problem with their liver or with their kidneys or whatever. And a lot of them get thrown out then. They have cardiograms to make sure there's nothing wrong with their heart. Some get thrown out then. So finally we get 2 groups of small numbers. And we give them this new medication that's never been given to people. And we watch everything. We do cardiograms. We do their bloods. Almost every day we do blood tests. We do examinations, skin exams, and listen to their lungs and heart. We do that every day. We watch these people like hawks, and they're watched 24 hours a day. And we're taking these samples 24 hours a day, so we're very careful. So when the study comes out, it is just showing safety. It is not showing whether it works or not, because the N is too small. The N is too small for safety too, but we're using it for the first time in humans. So we purposely use a small group in case something happens. And they know it when they sign up. That's the other thing. We need to do informed consent. Whenever I give a patient a new drug, I have to tell them how effective it is for what they have, why they would want to take it. I have to tell them the side effects, because that's informed consent. All of you know that word, informed consent. I'm informing them to be able to have them make a decision, meaning consent, based on what are the risks. Okay, risk-benefit ratio. What is the benefit and what are the risks? Okay, so then now I'm going to summarize. So then that's the first group. Then it goes to the next group. Then it goes to the next level. And the groups keep getting bigger and bigger, and we keep checking for side effects. And then finally, it's 4, and then it's a huge group. And then once it gets on the market, and the FDA, you can imagine the regulations that go on about this. So the FDA approves it after we have all of these studies and all of this evidence to show that it's safe and efficacious. Believe it or not, after it's on the market, then we find out that Vioxx causes all these problems. We have to take it off the market. It's already on the market. It had problems in me. I won't even tell you what, but just to say that even after all these studies, sometimes it's not until it's out in the open. So we monitor these drugs when they're out in the open. That's why anytime we have a problem with a patient, it's up to us doctors to notify the FDA that we had this problem. So what about, study N is the number in the studies. The P is the p-value, which I talked about last week. So the bigger the p, because it has a decimal point in front of it, in that case, the bigger the p, the more likely it is that the study results are accurate. If it's a small p, like 0.1, there's no statistical significance. 1 in 100, no statistical significance. Maybe 1 in 1,000, 10 minus 3, p equals 10 minus 3. Well, maybe I'm starting to think maybe it could have some statistical significance. So as far as hydrochloroquine goes, Chris's question was, he saw Dr. Oz, who recommended taking hydrochloroquinolone, and that every doctor he asked, 100% said yes, they would take it too. Should everybody be taking it? So last week I told you that I actually watched Dr. Oz. I had never seen him before. I really didn't know anything about him except that a lot of people liked him. So the first thing you do is you check your source. I'm not saying anything about anybody because this is totally apolitical and it's totally neutral. So I would say to you, look up Dr. Oz. Okay. So then Dr. Oz was in conversation with this French doctor, and the doctor in France, you check your source. You'll see if you go to Dr. Oz, you'll see this French doctor's name. The French doctor is someone who we know has questioned climate change, questioned whether climate change happens. Some of you may question climate change too. So I'm just saying most of us don't, and this doctor does. And there's something else he questioned, which I forget. So then let's look at the number in the study. The number was 80, n equals 80. Chances are it's not going to have a p-value. And it doesn't, as far as I know. Though it doesn't have a significant p-value anyway. We know it doesn't have significance. So those are the two things you know. And then, not only did they give hydrochloroquine, but they also gave an antibiotic, a Z-Pak. Most people know a Z-Pak, azithromycin. They gave that along with the hydrochloroquine. I'm going to call it Plaquenil. And I told you last week, Plaquenil, write this down, Plaquenil, Plaquenil. Look that up on drugs.com. So anybody can look these up these days. It's one of the great things we can do. So look up Plaquenil. When you go there and you look Plaquenil up, it says, number 1, it's an immunosuppression. It suppresses your immune system. Do you want to do that if you have this virus? Well, you might want to because there's some, I can't really say the details, but for some people have diseases where it's important to suppress parts of their immune system. But the second thing is, what is it used for? The main use is preventing or treating malaria. Malaria is caused by a parasite that is found in mosquitoes. And it goes from mosquitoes to humans. So it's a zoonose. Now you know what to call it. So it's an anti-parasitic drug. That means it's hard to kill parasites. That means you have to give a really strong drug to kill these parasites. So when you give a strong drug, that means it has a lot of side effects. So this drug kills parasites. It's used for prevention and treatment of malaria. And it's also used for two things that are very, that need a lot of help from inflammation. One is lupus erythematosus, and the other one is, I forget what, a common one. Someone will tell me pretty soon. Anyway, the people that have these diseases are having trouble getting their hydrochloroquinolone for lupus. For this, what is that other disease? Some doctors show it to me on the chat. Anyway, they're having trouble getting this medication for their really important and terrible, oh, I know what the other one is, rheumatoid arthritis. Everybody knows what arthritis is. This is arthritis times a factor of 1,000, where people get deformed arms and wrists and feet and legs. And so they take this hydrochloroquine to help control their arthritis. Now they're having trouble getting it. Why? Because, like with everything else, it's being hoarded. It's being H-O-A-R-D-E-D, hoarded by doctors, by patients, by any patient who can get their doctor to prescribe it for them. It's being hoarded. So are the toilet paper. It's being hoarded. You don't need, you're not buying how much you need for a week or 2 weeks. You're buying how much you need for a year. You're hoarding toilet paper, so now nobody can get it. Nobody can get Kleenexes now. My husband went yesterday to the store. Nobody can get toilet paper, Kleenexes, and there were a lot of other things too. Nobody can get, well, the worst one was ground beef. Not for me, but some people can't eat a hamburger. So are we taking care of our neighbors? Are we taking care of our fellow warriors in this army? Are we loving our neighbors as ourselves? We know that's a hard thing to do, but still, caring for your neighbor is important. So the next thing is a vaccine. Well, what about a vaccine? So somebody else, I think it's another cousin, they asked about someone else. She asked about could she get tested for this virus now when it was, I think, 3 weeks ago that she had the symptoms, and would it still show that she had it or not? Well, the answer to this is the current test is testing for some part of this virus, the virus itself. It's testing for, you know, RNA and DNA. It's testing for a type of RNA that's in this virus. And so it is going to be positive for the longest we saw, what, maybe a month. Could be positive. But then antibodies are a different thing. So I'm teaching you now how to think like a scientist and a doctor. Antibodies, A-N-T-I-B-O-D-Y. It's not like anti against the body. Antibodies are usually good, and your body makes them. There are different kinds, and they help protect you from different diseases. So the vaccine would help you make antibodies, help your immune system, help your bone marrow, which is a big part of your immune system, your bone marrow, the middle of your bones, help make antibodies to protect you from diseases, in this case from the virus. So I just saw that the FDA has approved the very first antibody test And I don't know what it is yet, and I don't know any details, but it shows progress. So there are, I'm just going to say 2 types of antibodies for those people that are really interested in this type of thing. One is an IgM antibody. That's I, capital I, small g, capital M. IgM, M is in Maryland. IgM antibody. That's the one that your body makes when you are actively infected. It's the first one that shows up when you draw blood. You find these antibodies by taking blood from people. And then IgG, I, capital, small g, capital G. IgG. That's the antibody that happens after a period of time, maybe 2 or 3 months. And it's the one that shows that you already had the infection. And it shows that that you're not going to get it again, except for some things where, yeah, some things you have to take several shots. But basically, IgG is what you're looking for protection from your body. So wait till you hear this. This is what I read. And my daughter says, oh, she's not surprised. She's just surprised they didn't do this already. I read that I think it's Google and Apple, or someone in Apple. Apple and someone who knows a lot about what I don't know about, technology. They're making something that you can put, an application, you can put into your phone that will tell you when you're near or getting to be near someone who's had COVID-19. But it would have to be the antibody test, okay? Not just the, no, not the antibody test, of course not. It has to be the test positive, which is the virus. So it's going to tell you when you're near someone who had COVID-19. So then you better wear your mask for sure, if you're not doing it already. Or maybe you better not wear your mask. No, I wouldn't count on that. I wouldn't count on that anytime soon, that they can tell you everyone. But just the fact that someone is thinking about how to do this, and Jillian says, oh, I'm not surprised. I'm surprised they haven't thought of it already. Just astonishing when you think about it. Okay, now we're going to talk about your armor. Number 1, you're not alone. Loneliness and isolation is one of the most serious things that is happening to people when they're locked up at home. They're lonely. They don't have family. They don't have anyone. But in this case, all of you are together. You're standing shoulder to shoulder with these people that know a lot, with these spiritual people like my Aunt Jeanette. These spiritual people, ministers, people who you go to church and hear in your virtual church on Sundays. Last week was Passover. Last week was Passover, and then my niece, Suzanne Rapp, she's the one who has the husband who gets 1 N95 mask for a whole week of taking care of new babies who have problems, 1 N95 mask a week. They had a Seder, and they did it by having their children who weren't all there join them on this thing where you talk on the phone and you listen on the phone. You can join each other. This Sunday is Easter, so for Christians, it's the most important holiday of the year, much more important than Christmas. This is when Jesus rose from the dead, so it's a very important Christian holiday. So people who normally celebrate at church are having to do the same thing as with the Seder. Or in our case, cook a ham for the 3 of us, a Christmas ham. But we can see our friends and family. We can connect with them. One of the things that is a piece of your armor is your mind's eye that I told you. Everybody has this mind's eye. It's an eye in your mind that can see things. It can see not only factual things, but it can see emotions. It can see how people are reacting to what you're saying. You're watching how it's affecting them. You can see all sorts of things with your mind's eye. So you're going to use your mind's eye to see your friends and family if you can't do this, if you're technologically challenged or you don't have things to look. One of the things that I heard recommended was to go through your address book and find people that you haven't talked to in years. I've done that recently. And you go through your address book and you haven't talked to people in years. And this is last week. I never thought I would see any high school classmate now. It's going on 55 years that we graduated from Youngstown South High School. Oh, Jillian says I better hurry up. I'll just say about 5 of us were on Facebook together talking about a 1,000-piece puzzle that 2 people had put together. 1,000 pieces. And we talked to each other about these 1,000-piece puzzles. And the thing about it was, this was the great part. I didn't realize it till later, but we were all 17. We thought of each other and we were all 17. So find your high school classmates and reach out to them. And your mind's eye, you can travel anywhere. You can travel wherever you've wanted to go, but you haven't had money, you haven't had time, or you've had disabilities, you can't go. But you can look up things. When I first went on Facebook, which was very recently, the first person I saw was Beth Lindquist. And she and her husband were on a cruise and they went to, I can't say where, but I'll just say that by putting their pictures on the Facebook, I went there too. I went there as well. And you can do that too, or you can create your own vacation. You've always wanted to go to France. You can be sure there are a lot of people from France in this army, and you can take your tour to France. You can go to the Louvre. Anyway, you can go anywhere you want. So that's your mind's eye, your power. You can grow any plant. If you can't grow it in your yard, you'll see the Victory Garden is in a very small backyard with hardly any soil. But anyway, you can grow any plant. Just find a picture of it. So these are just things that you can do. Oh, and you can sing, and you can dance, and you can scream. I'm thinking to myself, you can scream at the top of your lungs as long as you don't have a neighbor that's going to be worried about you. Sing, dance, scream. You need to get exercise at home if you're locked up. And this is another thing that was really, I thought, very powerful. It's about caring for others. So one person had an old person living next to them, and they could see each other's windows in their houses. So they got 3 pieces of paper, green, yellow, and red. Every morning, the old lady would put up a piece of paper of green, yellow, or red. Green meant, I'm okay, not to worry. Yellow meant, I need a check-in, I might need to go to the grocery store or something, have you go, but something is amiss. Red meant something's really amiss, come right away or call 911. Okay, green, yellow, red. I think many of us have a neighbor that we could do this with. Oh, I forgot to say, vaccine 12 to 18 months away. Don't even think of anything else. Every time I hear it, 12 to 18 months away, I know it has to be that. Okay. Now it's time for something called self-help. And for those of you who are waiting for me to say things that I said I would say today, but we don't have time, we'll say them next week, I promise. I promise. Because I want people to hear the words of people that are experiencing this COVID virus. So it helps you see, if you hear the words of real people, then you'll be more emphatic about keeping social isolation and keeping your distance. Okay, so the last thing is self-help. My friend Bonnie reminded me that that's the current way to call it. So there are 3 parts of this self-help. And this is where I'm gonna help you do this self-help exercise. The first part is going to be guided imagery. For those of you who are new on this, I'm gonna take you on a guided imagery where you feel different parts of your body and you help them relax. This guided imagery is to help you relax your body. The second thing is to help you relax your mind. Meditation will do that. Go on my website, you'll see, or just go on Deepak Chopra. I better just say my website. They have something where you click on that. He's with Oprah Winfrey. You can get him, the great world meditator with 2.5 million followers, to meditate with you every day whenever you want it. So this, we're going to meditate, and we're going to use the word love. When you say meditate, you say meditate on this or that or the other thing that helps you clear your mind. So we're going to use the word love. And the third is the one that I tell you to ask for help. Ask for help. You ask for help from whomever or whatever you pray to. For people that don't have a higher power, like God or Allah, they might want to just ask the universe for help. Maybe that's okay. If you're an atheist, you might want to ask the universe for help. But asking for help is really important. And when you ask for help, first of all, you say what you're grateful for. This is really important for you to think about what you're grateful for. I told you that story about the toothache. Look on the other ones for that. But think of what you're grateful for. Pray for others, or ask for help for others, and then you ask for help for yourself. So that's it. So I'm going to add, and also the ones who don't like this, it makes them feel uncomfortable, the ask for help part, just leave before they ask for help. I'll say, now we're going to ask for help, and that's when you would want to turn your video off. Or you can turn it off at any point. Isn't this great that you can come and leave whenever you want to? It's just amazing. Think of when you're in high school when you couldn't do anything. You had to sit there no matter how boring it was. Okay. Or medical school. How boring that was. Not really. Okay. I'd like you to close your eyes and go in a place that is quiet. Doesn't have to be dark, but it's easier if it's dark. Close your eyes and take 3 deep breaths in and out. Longer on the out than the in. So in, out. In, out. In, out. I'd like you to just listen to my voice and do what it's saying. Think about your toes. Concentrate on your toes. Think about having your toes relax. Wiggle them. Put them in whatever position you need to relax. Think about your feet. Same thing. Help your feet relax. Now think about your ankles. Move your ankles around. Are your feet and toes relaxed? Now you need to relax your ankles. Next, you relax your lower legs. Those would be your calves in the back and your shins in the front. Relax your lower legs. Next, your knees. Relax your knees. Next, your thighs. That could be the front or the back. Your quads. If they're cramping, you're not going to have them cramping. You're relaxing them. Your hips. Relax your hips. Now we're up to your torso. Your torso would be your abdomen. So relax the front part. This takes a little longer. Now relax your rear end. All those muscles, strong muscles. Next, relax your lower back, the lumbar area in your back. That's where so many people have pain. Now relax your upper back. And now relax your shoulders. Move your shoulders around. Make sure they're relaxed. That's hard to do. Now your upper arms down to your elbow. Relax. Relax your lower arms from your elbow to your wrist. Now relax your wrist. Move your fingers around, your hands around, relax those wrists. Now relax your hands. And now your fingers. Your neck. A lot of pain there. Move your head around. Relax your neck. Now your face. Relax your mouth. Relax your eyes. Your eyes are closed. You're breathing gently. Relax your face. Your forehead. Relax your forehead. Now your scalp. Your scalp, your hair. How sensitive is that scalp? Relax. So now your entire body is relaxed. Now we're going to meditate. We're going to use the word love to meditate. I need to say one more thing about the guided imagery, which I forgot to tell you, to go to your favorite place. Any place you can go in your mind's eye, any place where you can relax. Your favorite place. Now we're going to meditate. We're just going to do it for 4 minutes. But at home, I want you to work up to being able to meditate 20 minutes and do it twice a day. Do this whole exercise in the morning and in the evening. Check it off on your calendar, morning and evening, or on your phone, morning, evening. Meditate on the word love. So over and over in your mind, you say the word love in your mind, in your mind's ear. Say the word love. And if images come into your mind that are things that are bothering you, that are things you're thinking about, don't try to stop them, but just let them pass through so that you can go back to meditating on the word love. Let's start now. Now we'll ask for help from our higher power or from the universe. Those of you who are uncomfortable with spiritual things may leave now. So now we're going to ask for help. I'll give about 3 minutes for that. It's time to end now, but you can do more of this at home. So I will say to you, stay safe, stay strong. Thank you. Aloha.